Hey guys, tonight we're diving headfirst into the delightful world of medieval surgery, where hygiene was optional, pain was mandatory, and every procedure came with a generous sprinkle of chaos. Now imagine this, a dimly lit room, candles flickering, the smell of herbs barely masking the scent of blood, sweat, and something that may or may not be plague. And you, the unfortunate patient, are about to become the main attraction in a performance that would make modern medical boards weep. Yes, this is pre-anesthesia. No laughing gas doesn't exist. Your only comfort? A bucket for screaming. And maybe a friend to hold you down. Painkillers? Ha! The most sophisticated option is a swig of strong ale, which might make you forget you're about to be sliced open, until it doesn't. Medieval surgeons weren't exactly what you'd call highly trained by modern standards. Most were barbers, monks, or guys who read one book and decided that made them a medical authority. They were often proud, exceedingly confident, and probably thought antiseptic was a fancy new hat. Let's start with the tools. Scalpels, saws, hooks, and other shiny objects designed to inspire terror more than healing. These instruments were reused without sterilization. Don't worry, they wiped them on a cloth or dunked them in water. Sometimes they even used wine, not for cleanliness, more for flair. Imagine watching someone approach with a blade that's been in the last 10 patients' arms. Your veins are flaring, your pulse is racing, and the barber surgeon is humming a tune like, "This is a spa day." Spoiler, it's not. And now, let's talk procedures. Amputations were common because apparently the logic was, if it hurts, just remove it. Problem solved. No anesthetic, no pre-op tests, just a sharp blade, a steady hand, and someone muttering prayers that God doesn't mind bloodstains. Bloodletting was another favorite pastime. Got a headache? Bloodletting. Fever? Bloodletting. Poor life choices? You guessed it, bloodletting. They believed it balanced the humors, an imaginary system of bodily fluids that decided everything from health to your social charisma. The more you bled, the more virtuous you were, or something like that. Cauterization was the method du jour if bleeding refused to stop. Hot iron to flesh, efficient, horrifying, and guaranteed to leave a lasting impression. Your screams doubled as entertainment for the onlookers. Don't worry, that smell is totally normal, they said. Wounds were cleaned sometimes with whatever liquid was on hand, wine, vinegar, or a suspicious herbal concoction. Bandages existed, but think of them as decorative rags rather than sterile dressings. Infection was considered part of the process, and survival was more about luck than skill. Surgeons were also highly entrepreneurial. If they didn't have a client for surgery, they could always try dentistry, bloodletting, or pulling teeth, without anesthesia, of course. Want a tooth removed? Sure. Brace yourself, and try not to bite down on the neighbor's finger when the pain hits. Eye surgeries were especially dramatic. Couching for cataracts involved poking a needle into the eye to displace the lens. Yes, your eye. Yes, the patient could go blind. And yes, the surgeon would insist it's perfectly safe because confidence is everything when your job is terrifyingly reckless. Oddly enough, some surgeons had actual medical texts. Mostly these were copies of translations from Arabic or Greek scholars. Did that help? Occasionally. Did it prevent someone from chopping off the wrong leg? Not really. It did, however, give them the illusion of sophistication and a reason to charge more coin. Hospitals existed, but not like today. They were more like charity houses for the destitute and dying, often run by monks. If you were wealthy, your surgery might happen at home, where the barber surgeon could admire their handiwork while standing over you with dramatic flair. Amputations, cauterizations, bloodletting, trepanation, tooth extraction, all were standard fare. Trepanation is a personal favorite, drilling a hole into someone's skull to let out evil spirits, relieve pressure, or just because. The patient's survival, pure luck. The surgeon's ego, guaranteed satisfaction. Let's talk trepanation a little more. A hole in the skull. No anesthesia. Patients often survived, sometimes not. Those who did, bragging rights for the surgeon. Those who didn't, extra room in the local cemetery. Medieval surgery was efficient like that. Infections were rampant. The concept of germs didn't exist. Wounds festered. Gangrene was common, yet somehow surgeons still considered themselves experts. You'll feel a little pain, they'd say. You'd feel a little death, more like. And sutures. Linen thread, sometimes waxed with beeswax. Sterilized, not a chance. The patient might get stitched up only to discover their wound had grown an entire new culture of bacteria. Survival rates were often abysmal, but hey, some people lived, so it must have worked, right? Oh, and mid-surgery entertainment was encouraged. Monks might chant, a dog could bark, a cat could leap across the room, all while you tried not to faint. They claimed it calmed the nerves, but really it just added surrealism to the experience. Medical errors were frequent. Cutting the wrong limb, excessive bloodletting, misdiagnosing a simple infection as a deadly fever, all par for the course. Yet the surgeon's reputation often survived. Confidence and bravado mattered more than outcomes. Pain management, again, was a cocktail of strong alcohol, herbs, and stoic philosophy. If you screamed too much, they told you to man up. If you survived, they told you were lucky, and sometimes gave a certificate of bravery, which was basically a fancy way of saying, congrats, you didn't die this time. And it wasn't just humans. Animals also received medieval care, which meant cutting, bloodletting, and praying they didn't bite back. Veterinary practice, medieval style, was equally terrifying. Surgery manuals existed in manuscript form, full of illustrations of people with their innards exposed, diagrams that were supposed to guide but mostly inspired horror. The text often included prayers, reinforcing that this was as much spiritual as physical intervention. The prestige of a surgeon often came from surviving high-risk operations rather than successful ones. You could chop off a leg, cauterize it wrong, and still be celebrated if the patient lived a week longer than expected. Heroic incompetence was the badge of honor. Now imagine the social aspect. Surgery was public in many cases. People came to watch because why not? Public spectacle, educational demonstration, or pure morbid curiosity. Take your pick. You got a crowd, someone might faint, someone might cheer, and the barber surgeon got recognition. Pain, chaos, and unpredictability ruled the day, and that was considered professional excellence. If you survived, you were tough. If you didn't, well, that's the risk of advancement. Surgery could be used as spectacle, status symbol, and occasionally moral lesson. Surgeons bragged about the successful dismemberments, the uninfected amputations, the cleanly extracted teeth. In reality, luck and timing played a bigger role than skill. Let's talk tools again. Saws were used for limbs, needles for eyes, hooks for everything else. Each instrument was revered, polished, and waved in front of your face to increase anxiety. Imagine that Instagram story, except bloodier. Trepanation was marketed as innovation. "We are relieving the evil spirits," said the surgeon. "Also, there's a 50-50 chance you leave with the same number of limbs and eyes you came in with. But hey, spirits are free." Anesthesia might as well have been magic. Some tried herbal concoctions, opiates, or simply a prayer. Patients were told to be brave. Bravery was free and apparently a cure-all. Bloodletting remained the cure for every malady. Medieval patients frequently left surgery lighter, paler, and considerably more fragile than before. But they were alive. Sort of. Cauterization became a dramatic crescendo in the procedure. Flesh met fire, skin sizzled, blood boiled metaphorically, if not literally. The crowd clapped or screamed or fainted, depends on the day. Instruments were occasionally borrowed between patients, which was highly efficient if you ignore the minor details of infection. You might be thinking, surely someone knew better. Nope. Confidence trumped competence. Ego outweighed evidence. Bravado outweighed antiseptic. Survival was incidental. Surgeons also doubled as tooth extractors. Eyes, limbs, and teeth were all fair game. Every extraction was a performance, sometimes a gamble, often a public demonstration of audacity. Hospitals were just as chaotic. Imagine monks shuffling patients around, chanting prayers, while your surgery proceeds beside them. They had wards, which were basically crowded rooms where germs mingled freely. Sutures, if attempted, were a guessing game. Waxed linen threads became a sort of decorative accessory to your open wounds. Infection? Inevitable. Survival? Unpredictable. And let's not forget the aftercare, which was mostly prayers and herbal poultices. Comfort was minimal, pain was ongoing, infection was likely, hope was optional. Surgeons billed for all of this. Coins were collected, reputations inflated, and patients occasionally survived to tell the tale. Sometimes that was enough to maintain a thriving practice. And so, medieval surgery carried on, a mix of horror, bravado, luck, and occasional genius. Patients left changed, sometimes permanently. Surgeons left confident, always ambitious, and society collectively pretended this was medical science. In conclusion, medieval surgery was terrifying, chaotic, mostly ineffective, and endlessly fascinating. Pain, blood, and incompetence reigned supreme, yet somehow people survived. Sometimes. And that, dear viewer, is the brutal art of pre-modern medicine.